Okay, welcome into the AAFE Training Center treatment room. We are back in the treatment room and our patient is Lauren. So come on in. Let me show you, let's show you Lauren, who's had treatment before. And people always ask me when you have treatment, but she's so young, right? What does she need treatment for? So tell everybody what we're doing today.
We're gonna do Botox in my Masseters because I grind and clench and it hurts a lot.
Right, and where are your Masseters? Show them where it hurts.
Like right here.
Right there. And both sides? Does it usually hurt both sides?
Yeah, right side definitely worse, but both sides.
Right, and she actually, I think last week, and we're just getting to you now, I'm sorry, but it was like, my Masseters are killing me, right? My jaw muscles are killing me. So we're gonna go ahead and give her some Botox in her Masseter. So let me just show you a little bit because the actual treatment is gonna be incredibly quick here. But first of all, take a look at her facial shape. Just look right straight ahead for that and bite your teeth together for me. And I'm feeling rock hard Masseter muscles and that squares off her jaws just a little bit. So just relax again for me. And if we go ahead and take these Masseters in a little bit over the course of a few weeks, this will slenderize just a little bit, which will make her look really great. She looks great anyway, but this will just give her more of a heart-shaped face. We actually, if you folks have paid attention in the last few months, have done some cheek enhancements on her, and those are looking really good all the way to the anterior cheek and back along the zygoma, and you can see that. So this, taking this down, which she needs every few months because Botox will last up to about 3-4 months, and we've been giving it to her, so it does last a little bit longer right now. But let me give you a little bit of how we look at this. I don't usually mark patients for you, but let's go ahead and give you a little anatomy lesson here to do these injections here. And by the way, every single dentist, nurse, physician, anybody giving Botox can do this, both for TMJ and headaches, which these muscles are very, very involved in for oral facial pain, and for masseter slimming there as well. So here's her masseter muscle. Generally, just bite your teeth together for me. Real hard, rock hard. I mean, literally rock hard. So what I'm doing is I'm going to outline the anterior masseter and bite down again for me, and the posterior masseter. And generally when we teach in the AAFE to give this, we are going to hold the anterior and the posterior masseter tight and to go ahead and give her the injection of Botox. But here's where you really know to your anatomy. When it comes to the AAFE and we teach good technique, it's about 3 things: anatomy, safety, and technique here. If you are a little too anterior on the masseter muscle, you are going to go ahead and hit this muscle called the rosarius. By the way, in facial muscles, there are probably anywhere between 40 to 50 of them that we will inject Botox into or have to be aware of for this. If I am giving this injection into a little bit too far anterior in the masseter muscle, and I hit this muscle, which is called the rosarius, you can see it comes to the side of her mouth. And by the way, there are all kinds of muscles that come to the side of her mouth, okay? I'm just drawing some of them without telling you what they are for that. I mean, literally, look how many muscles come to the oral commissure here. If I take out any of these muscles that I shouldn't take out, when she goes back and smiles, and these muscles, and you can smile for everybody, the corner of her mouth goes up, it goes back, but if I take out this muscle especially that draws it straight back, it will look like she's got a Bell's palsy if Botox gets to this muscle, or she's had a stroke, which, you know, we don't wish that on anybody for this. So you want to really make sure that you are in the muscle that you're targeting. Now the masseter also has the deep masseter, the superficial masseter. Bite your teeth together for me. And we're going to go straight for this big lump. Many patients have many lumps along here. We're going to go straight for this big lump, the biggest part of her masseter. The other thing I want to teach you, and this is why you've got to get to an AAFE live patient training when it comes to Botox. The other thing is there's also a muscle here called the platysma that comes all along here. It comes up. Many times there are many variations of the platysma, which is the neck muscle. It can go way up into the masseter, many fibers of them as well. So you really got to isolate the masseter muscle here when you give this injection on this. And that's exactly what we're trying to accomplish accomplish to really get her relief. Now, I'm not knocking out the entire masseter. If I knock out the entire masseter, she cannot chew, eat, drink, talk very well for that. So I've got to give her the, bite your teeth together again for everybody. You see that masseter kind of pop out. So it's right now it's really, really tight and it's really, really strong. So what I want to do with my botulinum toxin and Botox injection in this case is give her just some to reduce the intensity of contraction. So right now she's like grinding so hard, but I just want to make it so she's got full competence. She can eat, drink, talk, use that masseter muscle for chewing, but she will have, it won't be working so hard. Slenderize her face after 2-3 weeks when it kicks in and the muscle has had a time to relax, but the Botox actually will kick in just a matter of like 2-3 days. And some patients it's faster, some patients it's slower. Here's the actual injection using a ComfortTox needle, very simple for this, and safe technique, the AAFE safety injection perfection. I'm going to get it to place, I'm going to aspirate, nothing there, and I am going to deliver as fast as you can possibly deliver that injection there. How was that?
Good.
Without, yeah, that was great. So that's that. Let me show you the other injections here too. Without doing a lot of talking, we are going to also do her temporalis. The two biggest muscles called, and there are two of the three muscles of mastication, is going to be the temporalis, which is a big fan muscle on the side of her head here, and the masseter muscle. That gives her most of the oral facial pain and TMJ and all those different things that are comorbid conditions here. Right now, I'm just palpating. First of all, you can't palpate the temporal artery, so you know where to stay away from, but bite your teeth together again for me. And if you take a look closely, just relax. Bite your teeth together again. There's a little big hunk of muscle that is just going ahead and popping up right here. That many times, this is the muscle that many of you, if you are having a headache, like you feel it's right in this pinpoint, and this is the area pretty much that bothers her as well. So I am going to give her and deliver right in that muscle. Right here again, I'm going to deliver, you're going to aspirate, you're going to just go ahead and deliver it as fast as possible there. And this has worked for you well before, right?
Oh, I mean,
yeah, it works really well for her. Now turn all the way to the other side. We're not going to mark it at all, so let's just do these injections for that. Now here's what it looks like after you've been trained. These are the fastest injections for me. Bite your teeth together for me. Hold it right there. Right there is where I'm going to go. This is the entire treatment time when it comes to this injection here. So let's do that one more time. Up in here, bite your teeth together for me. So you know, the actual treatment of this is less than a minute for all this. This I'm going to get to place. I'm going to aspirate. It's in a much more delicate area, and I'm going to give that, and I want to give one more to kind of bite your teeth together again for me. I want to go right up here and aspirate. And again, you must know your anatomy, you must know what you're doing there, and that is the entire treatment that she is getting for Botox today. Now, what are her post-op instructions? Very simply, don't touch her face. I do not want her to go ahead and move any Botox around, and she can move the Botox around to places where I don't want that Botox to go. I want it to stay in these muscles right here. Also, don't go out into the heat, not a problem today, but don't go out into the heat, don't do hot yoga, don't go work out for the rest of the day, all those things, because Botox and botulinum toxins, Botoxium and Dysport are very fragile proteins, and the first 2 to 3 hours are the most important for this to go ahead and start binding to the neuromuscular junction to get the Botox effect to reduce the intensity of contraction of that muscle.
Like, you can start noticing within like 5 days, but full effects like 10.
Right, so she, you know, some people it's literally 2-3 days. Other people on her, we know from before, and she'll know, patients will always know, about 5 days she'll start to feel that, and then 10 days full effect. But for the actual slimming of the muscle, that takes time. Once you've reduced that masseter muscle, that big, thick jaw muscle, that takes about 2 to 3 weeks because it's not working so hard, it starts to calm down, and then you get that facial slimming effect there. So thank you to all of you who are with us today. We'll see you again soon in the AAFE Treatment Center.